Hello, this is Naomi Carter. Today we are doing a special on the genetic disorder hemophilia. Hemophilia is a rare genetic disorder where the blood does not clot properly. It affects mostly males of any race and nationality. Now to Caitlin Carudi with more information on what hemophilia is.
Hemophilia can affect people of any race or nationality. There are two kinds of hemophilia, hemophilia A and hemophilia B. In hemophilia A, the person is missing clotting factor 8, and in hemophilia B, the individual is missing clotting factor 9. Clotting factors are proteins in the blood that help the blood clot to prevent extensive bleeding. Males are much more likely to get the disorder than females. For hemophilia A, 1 in 4,000 to 5,000 males are affected worldwide, and for hemophilia B, 1 in 20,000 males are affected. There are 3 different levels of severity: mild, moderate, and severe. For mild hemophilia, they have 5 to 30% of the normal clotting factors in their body. For moderate hemophilia, they have 1 to 5% of the normal clotting factors in their body. For severe hemophilia, they have less than 1% of the normal clotting factor. The normal clotting time is 2 to 3 minutes. Symptoms of hemophilia include excessive bleeding, such as blood in urine or stool, unexplained bruising, nosebleeds with an unknown cause, prolonged bleeding from injuries, swelling, and bleeding in the brain. Excessive bleeding occurs because of the blood not being able to clot properly. The amount of bleeding depends on the severity of the condition. Other symptoms include tightness in joints, irritability, seizures, vomiting, and headaches. Hemophilia is diagnosed when someone has a bleeding problem. They visit a doctor who then looks into the family and personal history for any relatives with the disorder. They may need a physical exam and blood test for the diagnosis. They will record information that includes how long it takes for your blood to clot and if the blood has low clotting factors. These tests will show if the person has hemophilia or not. Hemophilia is an X-linked disorder. It is more common in males because they only need one affected X chromosome to have the disorder. Ryan White was a famous young boy who was affected by AIDS. What many people don't know is that he also had hemophilia.
Now I'm here with Heather Yuo. Heather has hemophilia and she's here to explain more about this rare genetic disorder. It's especially rare for her because she's a female and mainly males get the disorder. Now Heather, how would you describe hemophilia? What is it like to live with the disorder?
Well, having hemophilia restricts me to many activities. Like sports, I have to do low impact sports. I can only do lower impact stuff like golf or swim or take longer walks. But when I was little, I had to wear protective padding around the house to prevent from getting cut, like bleeding, for any sharp objects or like furniture corners.
Okay. Now how is hemophilia transmitted?
Hemophilia is an X-linked disorder, meaning that only pretty much mostly males get the disorder because they only have one X chromosome compared to females who have 2. The females have a chromosome that can mask the other, so the female can be a carrier.
Okay. Now what is the prognosis or outcome of hemophilia?
The outcome could result in the destruction of joints and bones, bleeding in the brain, and long-term bruising. Destruction of the bones and joints is caused by buildup of the blood in joints, which eventually becomes severe to the point where my joints aren't able to move at all. Bleeding in the brain is caused by an injury to the head that causes internal bleeding, where the blood is unable to clot. Long-term bruising is caused by blood not being able to clot properly. Bleeding into the muscles can cause damage to nerve, and sudden bleeding can occur with my emotional stress.
Do you know the life expectancy of people with hemophilia?
The life expectancy of people with hemophilia varies depending on if they receive proper treatment. Without proper treatment, they could die before even reaching adulthood. Luckily, I have proper treatment, so I will probably live 10 years less than the average person.
Okay. Now, you mentioned proper treatment. What treatment is available for people with hemophilia?
The main treatment option for people with hemophilia is replacement therapy. It involves injecting clotting factors, 8 and 9, to control the bleeding. 8 and 9 clotting factors are proteins that are identical to the missing clotting factors. They are injected into the veins and they take place of the missing factors to help my blood clot properly. I also go to physical therapy at a clinic to preserve my mobility, and they give me low impact exercises to improve my muscle strength and my joint flexibility. It also helps to maintain a healthy weight.
Okay, now how would you get these factors?
Factors are mainly donated from human plasma. It can come from donated human blood or components of genetically engineered cell lines made by DNA technology.
What happens after these factors are injected into your body?
After the injections, my blood becomes normal for a couple hours.
Okay, now is this replacement permanent?
Unfortunately, it's not permanent. Half of the factors usually leave the blood every 12 to 14 hours. The antibodies in our systems kill the injection replacements, causing them to stop working. Or sometimes they can even kill the factors before they even begin to work. That means with these, I have to take it every 3 days so my blood is able to clot properly.
How often does the treatment have to be performed?
Usually every 2 to 3 days.
Okay. How would you say the treatment affects the immune system?
Factor replacement therapy affects the immune system. In some people with hemophilia, the immune produces an antibody known as an inhibitor that prevents the action of replacing blood products. It also prevents blood clots from forming. The presence of an inhibitor makes the treatment excessive more difficult.
Okay. How does hemophilia affect the skin?
It can affect the skin in many ways. It can lead to skin discoloration, pain, or swelling. Skin discoloration or bruising is caused by blood leaking below the skin. People with hemophilia may have larger bruises because in many places the blood isn't clotting to make the bruises go away. Swelling is usually caused from a buildup of blood in the skin because the blood is unable to clot properly.
Okay. How does hemophilia affect the circulatory system?
In the circulatory system, there are about 14 different clotting factors that work together to stop the bleeding. If just one of them is missing, your body has a hard time forming a clot. Some people who are missing the clotting factors will bleed longer than someone who isn't missing any.
Okay. Thanks, Heather. It was great talking to you. Now back to Noah.
Well, that's a wrap. Until next time, goodbye.